All right, we've got a couple folks looks like already have joined the workshop here. We'll give it a few more minutes, see if a couple others do join today, and then we'll get started at about 10:35. For Liz and Ron that are out there, can you see the screen with the slides? If you want to just type in the window there, if you can see the first slide there. Okay, we're going to go ahead and get started. So thanks those of you that have joined today's first Q&A session here. And the format, if you saw the preview video I sent out, it's going to be relatively short each week here. We're going to do these every Monday. And basically, it's going to start at 10:30 a.m. Eastern Time. And we'll go over a very brief topic to start the session related to Medicare. And after we do that, it's probably about 3 to 5 minutes, just touching on a brief topic. We'll follow that up with a Q&A session. So really give people an opportunity. If you have a Medicare question you would like to ask, it can be related to the topic we're discussing in that particular day, or it can be something that is completely different, just related to Medicare. And we can certainly help answer those questions here on the live Q&A. These sessions could go anywhere from 15 minutes, end to 10:45, to could go all the way to 30 minutes if we get enough interaction and enough questions going on these sessions. You can type a question at any point during the session, right in the window there in Facebook. It doesn't have to be waiting until we're done that first section. You can just ask the question at any point, and we'll get to the questions at the end. Make sure we get everyone's questions answered. So I would like to start off just to, for those of you that did join, give you an opportunity for a brief trivia question to win a free gift card, either to Starbucks or Amazon. So each week we'll have a little enticement, I guess, for folks to join, in addition to obviously the content that you'll get from a Medicare perspective. And the winner will get a $10 gift card, either Amazon or Starbucks. And basically, it's the winner has the first one to put the correct answer typed into the window for the Facebook Live. Today's question is, in what year did Medicare begin? So this is not the year that the bill was signed, but the actual year that Medicare started, and when beneficiaries could start enrolling into Medicare. So first one to type in the answer into the screen gets the $10 gift card, either Amazon or Starbucks. Looks like Clem has an answer. It's hint. Charles is correct. So Clem looks like was the first one to answer in 1965, which was the year the bill was signed. But the actual the year that folks could start enrolling in Medicare was 1966. So Charles Hobson, you're the winner of the first $10 gift card. We'll contact you offline directly to find out which card you would like, either Starbucks or Amazon, and get your information and mail that out to you. So thank you, Charles and Clem, for guessing there. All right, so this week's topic, and I'll just briefly run through. These are going to be the topics over the next 8 weeks. Again, it'll be about 3 to 5 minutes, just touching base on the particular topic. And then the next 10 minutes or so, it could be 10, 15, 20 minutes, depending upon the questions that come up. We'll take up the rest of the session. So this week, we're going to start very basic with what is Medicare and who qualifies for it. And then next week, we'll get into more detail about what Part A of Medicare covers. Following week, what Part B of Medicare covers. And then we'll get into, on June 25th, we'll talk about the Part B premiums and the income-related monthly adjustments, or IRMAs, on those Part B premiums. Followed by the following week, we'll talk about the key differences between Medicare supplements and Medicare Advantage plans. July 9th, we'll talk about, do you have to sign up for Medicare at age 65? And we'll talk about a few different scenarios related to when you should be signing up for Medicare. July 16th, we'll talk about what we refer to as the COBRA trap as it relates to Medicare, and what the impacts are for folks that are going to be looking at COBRA with Medicare eligibility, and what the potential downfalls are. And then July 23rd, we're going to talk about the donut hole with prescription drug coverage. What is a donut hole, and does it taste good? So each week, again, there's going to be very brief topics we're going to discuss, and then we're going to open up for Q&A. You can type your questions, again, at any point during the session. It does not have to be related to the topic for the particular week. It can be any Medicare-related question. So here's this week's first topic, which is what is Medicare and who qualifies. So Medicare is the federal health insurance program for individuals who are 65 or older. That's one way you can qualify for Medicare. Another way to qualify is if if you're on Social Security disability for 24 months. That's another way to qualify for Medicare coverage. Another way is if you have end-stage renal disease. So you could be any age. If you get diagnosed with basically kidney failure requiring dialysis, it's also called ESRD or end-stage renal disease. This is another way you can qualify for Medicare. There's no 24-month requirement with ESRD like regular Social Security disability requires the 24 months before you qualify for Medicare. And then also individuals that are diagnosed with ALS or Lou Gehrig's disease. This one's not as common as ESRD, but this is also another way that you can qualify for Medicare and start getting Medicare benefits. It's a very costly disease to treat, and therefore Medicare has decided to cover ALS as well as ESRD. Medicare, what is it? It's insurance. It's health insurance. It's not Medicaid. Some folks confuse Medicaid with Medicare. Essentially, Medicaid is health insurance. That's a federal program also, which also works with the states, but it's based upon lower income qualifications as far as folks that qualify for Medicaid. So there are two different programs. Medicare, again, is generally for folks 65 or older with a few exceptions. It's not income qualified, whereas Medicaid is not really age specific, and it's more qualified based upon income levels. Now, the different parts of Medicare, and again, we're not going to get into a lot of detail today. This is just a very high level, but there's Part A, which is hospital coverage. We'll talk more about this next week as far as what's covered under Part A. Part B is medical insurance. So that's really your doctor's visits and other things outside of the hospital. And we'll hit that in more detail in week 3. Part C is called a Medicare Advantage plan, which is a different way for you to take your Medicare benefits. That's the fully privatized option, which we'll talk about further in future sessions as well. And then Part D of Medicare is the prescription drug coverage. So those are really the high level, the 4 different parts of Medicare. And like I said, we'll get into more detail in the coming weeks. So I'm going to open it up for questions at this point. And again, like I said, each week we're just going to have a brief topic, and that was really just touching on at a high level how do you qualify for Medicare and what does it cover? But we're going to get into more detail in the coming weeks. And while we're waiting for some of the questions to come in, one thing I will mention as well, and I'll show you quickly here on our website, is we do have longer Medicare workshop sessions. If you're looking for a kind of a fully detailed workshop, you can watch the video on our website at senior-advisors.com. It's about a 90-minute workshop that goes through all of Medicare and all the different pieces of it, and Medicare supplements versus Advantage plans, et cetera. You can find that right on our website. We have live workshops where folks can attend as well. Again, those are about 90 minutes. But these live Facebook sessions were meant to be just a nice brief touch base on a specific topic and give folks an opportunity to really ask questions and get their answers to their questions. So, all right. Any questions out there? Okay, so Clem has a question. How does one know how care is coordinated with private insurance? So Clem, I'm not sure when you say private insurance, if you're referring to a group health plan or a individual insurance plan, or you're talking about a Medicare Advantage plan. So I'll try and touch on each of those topics. But if you have an individual private plan retirement coverage. Okay, thank you for clarifying, Clem. So the question is, how does one know how care is coordinated between Medicare and a retiree health plan? So essentially, the most important thing is once you become Medicare eligible, so assuming you're 65 or older and you've got a retiree health plan, which is generally an employer-sponsored plan or employer contributes a portion to the plan. You're no longer working for that company. You've got retiree health benefits. Medicare is always primary. So that means at age 65, you have to have parts A and B of Medicare because that's going to be the primary payer for your benefits, your health benefits. The retiree health plan then becomes secondary as a secondary payer to Medicare. Now the question, and this might not be the answer you're looking for, Clem, but there isn't a specific document that explains exactly how Medicare will coordinate per se with the retiree plan. The reason is every retiree plan is different as far as coverage goes. What we do know, and what you do know, is that a certain amount that Medicare is going to cover with regards to your Part A services as well as your Part B services. Generally, under Part B, it's about 80% is going to be covered by Medicare, and under Part A, there's going to be a deductible in the hospital and we'll get into this more next week as far as how Part A works. But for the first 60 days in the hospital, there's a deductible, and then there's copays for day 61 through day 90, and then for day 90 plus in the hospital, there's additional copays under Part A of Medicare. So your retiree plan would essentially pay a portion or towards the Part A exposure as well as the Part B exposure. But unfortunately, there isn't a document that says exactly what it's going to pay because every retiree plan is different, and it's going to be specific to your particular retiree plan and how those benefits work with your retiree plan. So I hope that helps a little bit. I know it's probably not the specificity you were looking for, but it's because every retiree plan is going to be different. And we'd be happy to look at yours specifically if you want to reach out to us directly, Clem. We could certainly do that and take a deeper dive into your specific plan. All right, the second question from Clem, does the retiree plan act as a Medigap plan or something different? And how would I know? Again, this is going to be specific to your retiree plan. It's possible that the retiree plan you have will work just like a Medigap plan. There are retiree Medigap type plans out there that would just pay secondary to Medicare, like a Plan F, for example, with a Medigap would pay the other 20% that Medicare doesn't cover. It covers all the hospital exposure under Part A as well. So it's possible you have a retiree plan that's structured just like a Medigap plan, but it's also possible that it's just a separate structure. And so how would you find that out? You would ask for what's called the summary of benefits or the outline of coverage for your retiree health plan, and that should explain as far as how it would work with Medicare. And again, if you want us to take a look at that for you and help explain that to you, we'd be happy to do that. If you want to, reach out to us and get us a copy of the SBC summary of benefits or the outline of coverage for that retiree plan. All right, the next question from Liz: will any doctor accept Medicare? So if you're on original Medicare with a Medicare supplement, you can go to any doctor or hospital in the country that accepts Medicare. It's still about 99% of hospitals and 90% of doctors still accept original Medicare. The top 20 hospitals in the country still accept it. According to U.S. News and World Report's top 20, we went through that list, and each of those still accept original Medicare. If you have a Medicare Advantage plan, however, those are the private plans. Where you'd have to go to, in most cases, they're HMO type plans. We'd have to go to their doctors for that insurance carrier and their hospitals for that particular network. Although some Medicare Advantage plans are now offering a PPO network, which allows you to go out of network for your services. So there's, Liz, the answer to your question. All right. We'll give it a couple more minutes to see if there's any other questions out there. All right, while we're waiting for more questions to come in, I'm going to go back to the slides. I'm actually going to show you on our website if you're interested in the longer workshops that we do have out there. Let's see here. Figure this out. Another question from Liz: do Medicare plans need to be renewed annually? If you're on a Medicare supplement or Medigap plan, those are guaranteed renewable for life. So there's nothing additional for you to do to keep that plan each year other than to continue to pay your premiums. The Medicare Advantage plans, as well as the Part D prescription drug plans, are annual. So those plans only last for the calendar year. They open up annual enrollment between October 15th and December 7th each year. That's your one opportunity to review your prescription drug coverage or your Medicare Advantage plan and potentially enroll in a new plan the following year. It's possible that the plan you have would no longer be available or be changing. So with the Medicare Advantage and the prescription drug plans. Again, with the Medigap or Medicare supplement, which we'll talk about the differences in the coming weeks, those are guaranteed renewable, and those there's no additional change required each year. Clem has another question here. How are IRMAs changing for 2019? Okay, so IRMAs are those income-related monthly adjustments. So folks that are in a higher income bracket, the base level income bracket is $85,000 for a single, and it's $170,000 for a husband and wife. That's based upon their income. The base level, if you're below those numbers, you just pay the base Part B premium, which this year is $134 a month. However, if you're in a higher income bracket, you have to pay these IRMAs or income-related monthly adjustments. And there's 4 or 5 different brackets above the base level. The highest bracket this year for an individual is $160,000, and for husband and wife is $320,000. And if you're in that highest income bracket, it actually gets very costly. The Part B premiums plus the IRMAs come out to about $503 a month per person if you're in that highest income bracket. The question is, what's changing for 2019? There was a bill passed earlier this year related to these IRMAs, and the basic change for next year is they added another income bracket above the current highest amount. For an individual, it's going to be $500,000 a year, and for husband and wife, $750,000 a year. And if you're in that highest income bracket, you're going to pay about 5 or 6% more than the current highest income bracket. So we don't have the exact numbers yet because they don't release those numbers until like November, December for 2019. But we do know that they added a new tier for that higher earner, and they will pay more as a percentage than the current highest tier. Again, it's about 5 or 6% more per year than the current highest tier. So hope that helps answer your question, Clem. The next question was Teresa Martini. Can I add to a health savings account that I started when working? So Teresa, I'm not sure if your question is Medicare related. So in other words, if you're Medicare eligible, you're past 65, and you have a health savings account, if you are enrolled in Part A of Medicare, which is the hospital benefit, you can no longer contribute to a health savings account. There will be penalties, and you will not get the tax benefits of those contributions once you become Medicare eligible. So, or actually, once you become enrolled in Part A of Medicare, I should say. So we don't generally recommend if you are after age 65. A lot of folks have Part A of Medicare. That's the one you don't pay for. And again, you can no longer contribute to the health savings account if you're in that situation. So, not sure if that answers your question, Teresa. Or if it was unrelated to Medicare, if you were just asking a general HSA question. All right. All right, any other questions out there? I'm going to quickly jump back to the slides. We're going to do one more giveaway here for the gift card. Again, it's a choice of a $10 Amazon gift card or $10 Starbucks gift card. The first one that can answer in the window with the correct answer. The second question is, and we went over this today, at what age do most people qualify for Medicare? So all you have to do is type the answer in the window. The first one to type it in will win the $10 gift card for either Amazon or Starbucks. at what age do most people qualify for Medicare? And while we're waiting for Clem's the winner, 65. So Clem, will reach out to you offline. Beth, you were second, so Clem is the winner. We had a few other answers coming in, but Clem was the first one to put his answer in. So we'll reach out to Clem to get his decision on Starbucks versus Amazon and the address to mail the gift card. So the other question that came in while we were waiting here was, can you tell me if cataracts is covered, cataract surgery? And basically the way Medicare works with vision, it does not cover basic vision services. So your basic eye exam and eyeglasses, contacts are not covered by Medicare. However, medically necessary vision is covered. So cataracts will be deemed under medically necessary cataract surgery under Part B of Medicare, so it would be covered under Part B of Medicare. Elizabeth, your question, do I need to sign up for Part D if I'm not currently taking any medications? Is there a penalty if I don't sign up? Good question. So yeah, we generally recommend folks that are Medicare eligible, if they don't have other credible drug coverage, they should sign up for a Part D plan, really for two reasons. Number one, there is a penalty if you don't sign up for Part D when you're supposed to. And then 2 or 3 years later, you want to sign up for a Part D plan. The government charges a penalty of 1% per month for every month you don't have Part D when you're supposed to have it. So if you wait 2 or 3 years, you're talking 24 or 36% penalty on your Part D premiums. You pay that penalty not just for 1 month or 1 year, but for the rest of your life. So we definitely recommend signing up for Part D when you're eligible. The other reason, obviously, is if you do get prescribed a medication mid-year, you want to have some sort of coverage to help cover the cost of that medication. So Part D plan would be a good option. And the least expensive plans out there in certain states, they're as low as $12 a month. In others, it's like $20 a month. So it's definitely worth signing up for that Part D coverage. Okay, Clem, are you going to show us where we can see the Medicare seminar? Yes, I was trying to share that screen. Let's see here if I can get back to Facebook. In the meantime, you can go to our website, senior-advisors.com. There's a tab at the top of the screen for workshops. If you highlight the workshops tab, you'll see underneath of that you can watch the workshop or you can register for a workshop. If you select watch, you'll be able to watch the video again, which is about a 90-minute video. And this time next week, I'll be able to actually share that screen. I'm having some issues. This is the first time with Facebook Live, and I can't share past this screen right now, Clem. But next week, I'll show you our website and how to find that as well. But again, if you just go to that website and go to workshops at the top, you should be able to find where you can watch the live workshop. So, all right. Any other questions out there before we wrap up for today's session? We'll give it one more minute and give folks a chance to ask any additional questions. Here's the topics again for next week is going to be what is covered by Part A of Medicare. So we're going to get into more detail under that hospital coverage and really break it down for you to understand what's your exposure if you just have A and B of Medicare. What's your out-of-pocket exposure versus if you have like a supplement to cover that. We'll get into that detail next week in our 3 to 5 minutes, and then we'll have another Q&A session to give folks an opportunity to ask questions as well next week. And then the following week, we'll get into Part B of Medicare in more detail. So we'll give it one more minute here, and then we will wrap up. All right. Well, we're gonna wrap it up here. I want to thank everyone for joining today. I hope you found this video helpful. And again, we'll do these each week, each Monday. And if you want to reach out to us in the meantime, you can certainly call either our Cranford office or our Moorestown office. You can go to our website and get more information there. You can email us. Also, you'll find that information on our website. But we hope you found this helpful, and we look forward to chatting again with you next Monday. Thanks, and have a great week.